back, Trinidad and Tobago. Well, that very informative clip introduces us to our next guest and next segment. Dr. Zahrid Mohammed is resident of ophthalmology at Caribbean Vitreous and Retina Surgery Limited. He joins us now. January is also Glaucoma Awareness Month. Dr. Mohammed, welcome. Thank you so much for joining us. Maybe we could just kick off with what is glaucoma?
Sure. So, morning everyone. Thanks for having me at this segment. So, as I said, glaucoma is actually a range of diseases with the eyes especially. It arises from increased eye pressures, and over time this actually damages the optic nerve, which is the important structure of the eye responsible for transmitting all the images that we see towards the brain. Any damage towards this nerve actually causes vision loss in the sense that patients get peripheral vision loss and progressively inwards and inwards until the point where they develop what we term as tunnel vision. Now, the worrying thing with glaucoma is that patients will be unaware of these kind of changes because they use their central vision for reading, for driving, for looking at their phones and televisions. But they will be relatively oblivious to the fact that this thing would have been going on for years and years. It's only when it reaches their central vision they become aware, and by that time it's relatively late. It's
very late. But in that case, are there any other symptoms that patients can look out for?
Right. So in extreme cases, patients may have pain. They may have some redness on the eyes, but by that time the eye pressures are way too high. They term glaucoma as the silent thief of sight, and rightfully so, because you can't really experience any symptoms that the patients can tell on their own. Now, commonly, they might think that their blood pressure could relate to the eye pressures, but that's a common misconception. You could actually have normal blood pressures over a period of time, but the eye pressures could be suspiciously high in the 30s, 40s, 50s, and the patients will be walking around normal with no indication of this being taking place.
What is the prevalence of this particular disease in Trinidad and as it compares to the rest of the world? Trinidad and Tobago compared to the rest of the
world? Worldwide, it's one of the leading causes of blindness. With respect to Trinidad and Caribbean, a couple of years back, we actually had about 30 to 32% of blindness in Trinidad being attributed to glaucoma, and a substantial portion of this would be undetected glaucoma, actually about 50%. And similarly for our Caribbean countries, brothers and sisters, we have a similar rate as well. So it's not something just endemic to us, but the worldwide and the Caribbean too.
Who's most at risk?
We have, over the years, developed a few risk factors that we notice in patients. The most common ones are family history. So mom, dad, brother, sister, especially anyone who has glaucoma. These patients should be screened at least annually to determine if they are at risk and if they have glaucoma and treated and managed accordingly. Over 40-year-olds as well, we are placed into this category. Short-sighted, far-sighted individuals should be screened at an earlier age, around 30, 40 years, and annually as well. We have also noticed that Afro-Caribbean, Hispanic, and Asian ethnicities are also prone to developing glaucoma at an earlier age. So these would be the four main risk factors we would identify in our population so far.
So, Dr. Mohammed, when someone goes for that regular eye test, are they also screened for glaucoma, or is it something specific?
Yes. Well, normally an eye examination at any eye care professional, we'll check the eye pressures because those are one of the risk factors as well. We'll ascertain their vision. We also do an examination of the eye thoroughly. So we'll be able to look at this optic nerve and see if there are any changes which may indicate they might be at risk. So we normally see an enlargement or pale looking optic nerve, which is the first sign that this patient may be at risk or probably has glaucoma and is unaware. When we see these typical signs, we normally move on to screening, which is non-invasive, painless, not harmful in any way, more or less just scans and photos of the optic nerve. The machinery is actually very sensitive and very detailed, so we can use this to track the dimensions of the nerve, can tell us the nerve layers which are otherwise not seen on examination. And we can tell for certainty if these patients are at risk or if they should be treated either aggressively or just monitored regularly.
So aside from screening, Dr. Mohammed, are there, screening, once glaucoma is picked up, it has to be treated and so on. But is there anything you could do to prevent glaucoma from coming on? I know when we were younger, we were always told eat carrots, they are good for your eyes.
Yes. So that's actually a good point. They have determined that some lifestyle changes can slow the onset of glaucoma, especially if you have a family history and you know that you're prone to develop it at some point. So balanced meals, healthy lifestyle, exercise has been shown to increase blood supply to the nerve, which aids in its health generally. Diabetics and hypertensives, they are prone to develop glaucoma over time. So control of blood glucose and blood pressures are fundamental as well. Normally, if we detect glaucoma through the various screening tools and there are no visual symptoms, we tend to manage casually in the sense that we can monitor for any changes, but we could also treat prophylactically. So we can start on topical medication, whether it be eye drops or non-invasive or the non-invasive techniques. And these help to actually slow the progression. But unfortunately, with glaucoma, we can't reverse it. So it's a non-reversible condition. That's why we tend to be more proactive with these type of patients because we want to preserve their vision for the rest of their life.
So just to be clear, once someone has lost their vision due to glaucoma, it cannot be restored.
Correct, and that's why these diseases are actually so devastating. As far as we know currently in the world today, there are no ways to reverse glaucoma. We can only stop or slow the progression.
And could you just recap? I know you briefly touched on it, you talked about the eye drops and so on, but what treatment options are available, and does the treatment options vary with the progress of the glaucoma?
Right, so yes, you're actually quite correct. So once detected early, topical eye drops is actually a sufficient management protocol for these patients. And they normally go for the rest of their life, needing just 1 or 2 drops per day, vision pretty much intact. For those patients that present later on with pretty advanced changes, we tend to be more aggressive with these. They may need 2, 3, sometimes even 4 different eye drops. And in some cases, they may not even respond as we would like to in these patients. And these patients, though they may be small, they go into a surgical category where they will need bypass mechanisms and surgical procedures, lasers as well, and in order to get the pressures under control. So it's a real struggle when they present at that late stage in order to try to get them to keep whatever vision they have remaining.
So it's Glaucoma Awareness Month. What would be your advice to just the common man out there in the public? I know you did mention those age groups over 35, those different categories, but if you could just quickly recap it and tell us what we can do to early screening, early prevention, and to prevent the progress of this disease.
So yes, early screening is the key. We hope that through forums just as these here, we can raise awareness of glaucoma and its devastating effects. Screening yearly is actually quite sufficient enough. The glaucoma progresses pretty slow, so we'll be able to pick up things on our annual screening. And that's been so far very effective. But having a diagnosis of glaucoma is not something daunting or debilitating. We like patients to focus on the future and be proactive, ask us questions, ask us what's their eye pressures, what's their vision going to be like. Will this help? Will some other options be available? And having this discussion with us allows us to meet their needs. If it's a cost factor, if it's an irritation or allergy factor, what are their hopes and their perspective with respect to their vision? So having the support of the family and the eye care professional is important as well. So having these consults and these talks with us actually help them going forward. So we encourage people to get screened, especially if you have a family history. That's the main one. Get screened, have a threshold, have a baseline. Going forward, you'll be able to control your own vision then, more or less.
Of course, Dr. Mohammed, in the times that we're living in, everything equates to a cost. You're attached to the Trinidad Eye Hospital. Is there any free screening that's available that people can just, turn up and be screened?
Yeah. So during the pandemic, we actually realized there was a deficit in eye care. Patients actually had a lot of trouble accessing eye care. We instituted the subsidized pricing or subsidized cost for a lot of our services. Glaucoma screening is one of those. We just want patients to get screened to know what their position is like in terms of their vision, to get the consultation, to have the advice given to them, and we manage based on that going forward. But it doesn't mean that their vision will deteriorate in any way, but we manage to the best of our ability given what we have.
And could you just remind our viewers of the contact information, what they need to know, how they can contact you guys, and how they could get the screening done?
Sure. So they can contact us at our call center, which is 235-4834. You can also visit our website, www.trinidadihospital.org. Or you could visit one of our offices. We're located at Masca Compound in San Fernando, and there's also St. Augustine in Warren Street.
Of course, and if you missed any of that, you just have to log on to their website, and let me remind you of that. It's www.trinidadihospital.org. Remember, it's .org.org. Dr. Mohammed, thank you so much for joining us.
Thanks so much.
And spreading the
Sure.
awareness, of course.
Thank you for having me.
Yes, of course. Early screening is, of course, the key. And as we head off to a break, we're going to do so with an image which was captured by a viewer in McBean, Vancouver. Very pleasant morning to you, McBean, Vancouver.